Continuing our reports on global medical services provided by Tzu-Chi International Medical Association, we'll take a look at Tzu-Chi's medical mission in the Philippines. While the Philippines has become more internationally competitive economically, 1/4 of its population still lives below the poverty line. Seeing how the impoverished people lack access to medical care, the TIMA Philippines chapter has been providing cataract surgeries and free clinics for numerous residents in need. Once known for its overseas labor, the Philippines has become economically competitive with the return of Filipino workforce.
I worked as a sailor for 5 years and saved up to buy a Jeep, so I drive to make a living now.
According to the Global Competitiveness Report released by WEF, in 2015, the Philippines has risen 33 places since 2010, when it was ranked 85th among 140 countries in the world. It has become one of the countries with the most abundant youth workforce. Despite such improvement, the Philippines remain among the ranks of low-middle-income countries, with a GNI per capita of $3,470 according to the World Bank. 1/4 of the Philippines' population of 100 million people are considered impoverished, and the gap between rich and poor is the largest among Asian countries. The rate with which lives are improving for the impoverished people is far behind the country's economic growth.
I cannot see clearly and have difficulty walking.
In the Philippines, 590,000 people are blind, and 80% of the blindness is related to cataracts. The blindness can be avoided with the provision of cataract surgery. Nevertheless, many patients delay their treatment due to poverty, leaving age-related and congenital cataracts untreated and more prevalent among younger patients.
He could not see for 5 years. He does not get enough nutrients. He looks older than his age, 65. We are about the same age, but he looks much older.
Dr. Antonio Say has been treating the impoverished patients for 18 years at free clinics and his 4 clinics. Back in 2013, Nida Potential's family was devastated by Typhoon Haiyan. Fortunately, the volunteers reached out and turned the 19-year-old girl's life around.
I felt like it was the end of the world when I could not see. Now that I regained my vision, I can start a new chapter of my life.
A cataract surgery cost between 40,000 to 50,000 pesos, which is about an impoverished family's total income in half a year. The Tzu-Chi Philippines Free Clinic Center in Manila was given permission to conduct eye surgeries after obtaining a license from the Department of Health in 2007. Therefore, the Tzu-Chi Philippines chapter is among the few Tzu-Chi chapters that were established to first carry out medical mission.
Whenever there is a great disaster, Tzu-Chi is always there. So we are not here just because to alleviate. We are here also to support.
The free clinics not only cure diseases, they also change the fate of the underprivileged families.
Miracle. At first, there are 2. They have to carry 2. In fact, I have carried both of them. It's so heavy. And when they come back, it's already separated. Oh, it's a miracle.
Once you see the smiles on the patients' faces, your fatigue will be gone. They smile from their heart and appreciate us, so I do not feel tired at all.
While poverty and illnesses often come in pairs, the medical professionals have relieved the suffering of countless people in need of medical care and tapped into the wellspring of love and gratitude in them.